Hi people, welcome back to another video where today we're going to be reacting to Dr. Mike, who will be reacting to Chicago Med. Let's get on to it.
There's Chicago PD, there's Chicago Fire, but I'm most concerned with, you guessed it, Chicago Med. Let's get started.
Doesn't look too bad, alright? You're gonna be alright.
Good triage.
45-year-old male, left leg amputation.
Treatment 2, treatment
That was a good triage.
GCS3, BP of 90 by PAL.
GCS3 is the Glasgow Coma Scale. 3 is very...
Learned that in GCS in when I took EMT. I think 3 is the highest, if I'm pretty sure.
bad. You need to be intubated. You're basically
Yep, 3 is the highest, and 3 is the most bad.
in a life or death situation at that moment.
He keeps biting down. I can't get the blade in. Look, you bag him. I'll do CPR.
If you can't insert a tube to help someone breathe, the one thing you can do is you can continue bagging them. That still oxygenates their airway. It's obviously not as ideal as putting an endotracheal tube in, but the most important thing is CPR, chest compressions, chest compressions, chest compressions.
Almost there. It's not time yet.
And what the heck is with them chest compressions? It looks like he's doing one hand. We'll do both hands. Okay, both hands. Like this. And we'll push down on the chest. We'll walk our whole body. We'll walk our whole body on the chest. We'll push down. But give the time for the heart to fill back up with blood or whatever. Take a CPR course, okay? It will learn better from taking the CPR course or watching a video, but taking a CPR course from me just explaining the ways on how to do CPR.
Never ideal to do chest compressions with one arm like that, but I can
More or less what I said.
understand if he's been doing chest compressions for 15 minutes. It's really tough. It's tiring to do chest compressions. I've done chest compressions for a while, and generally after each round you have a student or a resident standing behind you ready to jump in and start doing the chest compressions, because it's all about at least getting 2 inches of compression to the chest, which can sometimes break ribs, but it's all about getting them enough time to get to the hospital to hopefully save their life.
I got it from here, man.
Nope, he's mine.
Okay, who the hell is this guy?
Says he's a doc.
Get off the gurney, Doc. I'm senior resident in this ER.
Yeah, well, I'm your new trauma fellow.
Doesn't happen like that. Trauma fellows don't just run in. This guy could be anybody. You need to see some ID. I'm all for the show, trying to set up the stage for this character. But people don't just run into the hospital and say, I'm the doctor now.
Get a BP and keep giving him blood. Send a rainbow of tubes and a type and cross. Get his blood gas and get him to the OR.
Type and cross, again, you're trying to find out the correct blood type. For now, giving O negative is fine, but you don't want to keep wasting the O negative blood, so you want to do a type and cross. When he says the rainbow of tubes, that's basically tubes that are sent off for a wide array of tests, like CBC, which is a complete blood count, BMP or CMP, which is a metabolic panel, a PT-INR, which shows clotting abilities and clotting times.
No gag reflex, didn't even need sedation. Not good.
We got another problem. This woman's pregnant.
What he's doing there with the ultrasound is called a fast scan. It basically allows you to see if there's any internal bleeding going on, especially in the abdomen, because you can lose a lot of blood in the abdomen without even knowing that you're bleeding into the abdomen. But obviously in this situation, he's found that this patient is pregnant, which complicates the situation even more.
20-year-old male, cystic fibrosis, complaining of chills, labored breathing, temps 98.
Jamie? That you?
Hi, Maggie.
Back so soon?
I missed you guys.
Cystic fibrosis is a it's a deadly illness, unfortunately, and it basically, you build up so much mucus in your airway because you cannot clear the mucus out of your airway as efficiently as someone who's healthy and doesn't have cystic fibrosis. So you get very often lung infections, obstruction in your airway, and most people live somewhere into their 40s or 50s with the illness, and that's pretty much the life expectancy with someone who has cystic fibrosis.
Now, Mr. Dilson, I see that you're using inhaled antibiotics, tobramycin, albuterol. You wear a vibration jacket at night and use a humidifier?
The vibration jacket actually helps break up some of that mucus and allows it to naturally come out when a patient coughs. Very commonly we use something known as chest physical therapy, which is almost like clapping on the chest to help clear some of the mucus. Parents of young children who have cystic fibrosis are trained in giving their children this procedure.
Baby checks out fine. Healthy heartbeat, amniotic sac, and placenta are intact. Gina, though, I'm afraid, suffered a traumatic head injury, and so far she's unresponsive. We need to contact her family, if you have any information.
My husband and I are pretty much her family. She's been...
So another name for a traumatic head injury is best to sum it up is THI, traumatic head injury.
living with us since before the embryo was implanted.
That's such a difficult situation. I mean, to have someone be a surrogate to carry your baby, and then they're living with you and they're involved in this horrible accident and they have a traumatic brain injury where they're being kept alive by machines. That's going to be a tough decision whether or not to keep her alive using machines so that the baby can continue growing and get to at least to a stage where the baby can survive on its own following a C-section. Man.
Jamie, I've got your test results back. I wish they were a little more encouraging. You're pancytopenic, which means that your cell counts are low. You've got a blood pH of 7.14.
When your blood pH is that low, that means you're trapping carbon dioxide within your body, and you're having obstruction, which comes from the cystic fibrosis. That's very dangerous because when you go into an acidotic state like that, your enzymes within your body can't function, and you can die.
I'd like to intubate you, put you to sleep, get you on a ventilator. You're getting fatigued. This would just allow you to rest so that the antibiotics can do their job.
I've been intubated 8 times. I think I'll skip it.
The purpose of intubating someone who has such a strong acidosis is when you put the tube in, it allows the person to not work to breathe so heavy to expel all that carbon dioxide. The machine basically does it for them. And again, it allows them to rest, it allows the antibiotics to do their job, and it improves the pH quicker than the person can do themselves. Very uncomfortable, not a lot of patients like it. I've never seen, and again, I'm not a trauma surgeon, I'm not an ER doctor, but I haven't seen options given that, frankly, to patients. If a pH was that low in my hospital, generally we would strongly advise the patient to intubate them. But again, I'm not a super specialized in this field, so I'm just going off based off.
Again, Sam, I'm not super specialized into the CNA, and CNAs won't do intubation or be doing ventilators.
My own experiences.
Sherry?
Dr. Halstead?
Need to blow down her CO2, take her off the vet and bag her, give her a dose of Manadol, and increase her dopamine trip to 12.
Right away. Doctor?
Gina's intracranial pressure is rising.
What happens after an injury to the brain is just like any part of the body, there exists inflammation, swelling, edema, and the problem with having swelling inside the cranium is that the cranium is a skull. It's meant to keep things from coming in and protect you, but it also crams the brain when there's edema and swelling, and it actually damages the brain further and can be fatal. So you try and control it with medications. You try and give the patient something to reduce the swelling in the brain. There's also some physical things you can do, like elevating the head to hopefully get some of the fluid to come down. But in reality, if the condition gets worse, you need to do the surgery to open a piece of the cranium to allow the brain to swell and not cause increased pressure within the brain.
Intubating Jamie is the only hope we have of keeping him alive.
What's that going to give him? A week? 10 days?
It could be 6 months, a year, more.
This goes to the heart of the issue of patient autonomy, that they have the right to choose what happens to their body. I don't know how old Jamie is. Once you're at the age of 18 or older, you have the right to turn down medical treatments. You have the right and say that as long as you understand the consequences of what you're doing, you can undergo or skip any treatment.
So what Dr. Mike is saying is true. When we're 18, we can choose down medical treatment. We can be like, hey, I want this treatment, or no, I don't want that treatment. But then then if we say no to the treatment, we have to sign a paper that is against medical advice, saying that, hey, I turned down medical advice. I recognize what will happen and all types of that will understand that will can't even talk. That we can understand what will happen if we turn down medical advice and turn down medical care.
That you want. Nobody can force treatments upon you. I understand what the ER doctor is doing. I also understand what the psychiatrist is doing.
As soon as we hear something, I'll let you know. Rachel? Rachel, can you hear me?
What is wrong? What's happening?
I can't find a pulse.
Oh my God.
Well, the medical student is doing the exact right thing. Call the alert. Start doing chest compressions right away.
You're not compressing the heart, Sarah. You gotta go harder.
But she's so small, I don't want to...
Harder, do it. Let's go. Come on, Sarah, harder. Hold. There we go. Back inside us. Get a BP.
What happened?
She rested. We got her back.
Can't get an IV? Hand me your drill, get an IO line.
An IO line is an interosseous line. In children, sometimes it's difficult to put an IV line. Sometimes they need extra fluids. What we can do is we can drill
I will let Dr. Mike explain it since he always...
a little needle right, it sounds brutal, but it's really not that bad. Drill a little needle directly into the shin bone, and what that allows us to do is to give extra fluids and medications to that area.
And on adults, I don't know how big the needle will be, but it's kind of the same process. Again, I took EMT, and my instructor was a paramedic, so we talk about some stuff that paramedics can do. CNAs can't do IAO because that will be against the scope of practice. They have like a scope on what them can practice, and if we go beyond that scope, we can lose our certificate, and we can lose our license, and we can probably be sued, and a bunch of other things.
Little girl's ribs.
Reese, you saved the girl's life.
Breaking someone's ribs while doing proper CPR is part of the course, and the CPR actually saved lives. The ribs are an unintended consequence, but they're a side effect of trying to keep the young girl alive.
This is Jorge's. ¿Entiendes?
Yes.
Inside, I found this.
Why would you give that to her in this moment? That's so unnecessary. I promise this will not happen in the hospital.
What happened with the little girl?
She had a cardiac contusion. Bruising caused her to arrest. She's good now, but it was a real scare.
Sometimes when you have a direct injury to the heart, that can cause a contusion, which is just a bruise, and sometimes that can mess with electrical
Bruise on the heart.
activity of your heart and cause it cause you to have a cardiac arrest, which means that it just stops the cardiac rhythm. Actually, this is a common scenario during baseball games. If someone hits a line drive and it hits someone in the infield directly on the chest, if
So
it hits
a line drive is the straight, more or less straight in there. So a line drive, I know this because I play softball and baseball and sports. A line drive is straight to the chest, and it can cause bruising on the heart.
in a specific time of the electrical rhythm, you can actually stop the heart.
Jorge's brain was without oxygen for too long. Pasó mucho tiempo sin oxígeno.
We have translators in the hospital for moments like this. If you're going to have a conversation that's about life or death, you need a translator there. Your broken Spanish isn't the right way to communicate with the patient.
He's 20 years old. Without new lungs, he will die.
Tiene 20 años. Sin pulmones nuevos, morirá.
Your fiancé,
Tu prometido,
the man you love,
el hombre que amabas,
the man who loved you,
el hombre que te amaba.
I can't save his life.
A little unethical here. They're talking about the patient's condition to a non-family member. It's technically breaking information protocol, but I don't think they're going to get in trouble for this. I think they're doing the right thing. And that's why a lot of rules are open to interpretation. And I think here they're looking out for the best interest of the patient and maybe telling his patient information to somebody else, but in hopes to save his life. So I think legally this isn't right, but I think morally and ethically it's the right move.
Going back to the hospital?
Yeah. Wouldn't mind being there when he wakes up.
Can I come?
Sure.
I appreciate that the doctors want to spend their off time with the patient, but you got to recharge your own batteries. You got to get the 7 to 9 hours of sleep so you can make the best decisions for your patients the following day. Again, you want to be empathetic, but you don't want to burn out either, because then your future patients will suffer also. So it's a fine line between being a good empathetic doctor and burning yourself out. This is a good show, quality actors, quality script, good medical info, showed some very unique situations that have inherent drama built into them, but they were realistic. Based off this pilot episode, I'm definitely a fan, so thank you for recommending this. If there's another medical show you want to do, drop it down below in the comment section, and don't forget to subscribe and click that little bell logo to make sure you know every time I'm publishing a new video. As always, stay happy and healthy.
And that's going it for here. Thank you all for watching. Hope you all have a good day, good night. Click that little bell, turn on notifications, comment, share, and that's about it.